Great, thank you very much. So welcome to our String of Green Pearls meeting. As I was just explaining to the others, I'm Tanya Saker. I'm the Climate Resilience Programme Manager here at Volunteer Cornwall. I'm standing in for Annette and Martin, who are on leave today. And it's just an opportunity to touch base and find out where everyone's at, provide a bit of an update on everything, and share best practice and any ideas and funding opportunities and things like that. So could I ask if everyone just keeps their microphones on mute just whilst we're doing the intros, and then this meeting will be recorded and available to everyone that couldn't make it. So should we just quickly go around and introduce ourselves, given there's so few of us today. Stephanie Jones, do you want to go first, just because you were here first?
Oh, okay. I'm Stephanie Jones. I'm business manager and partner at the Druggy Help Centre in Hale.
Lovely, thanks for joining us. Daphne, do you want to go next?
Hi, yeah, Daphne Marston. I work with Natural England. I'm the South West Health and Environment Hire Officer, and my role is all around nature connection, getting people to get the health and wellbeing benefits of being out in nature.
Fantastic, thanks for joining us, Daphne. I know you got to shoot off. How long have we got you for? Oh, you're on mute.
So I'll have to go back 5-2, Tanya.
Okay, brilliant.
Yeah.
We'll come to you first. Stephanie from RCHT. No, from CFT. Sorry, CFT.
That's okay. Hiya, everyone. I'm Stephanie Pomeroy, and I'm from CFT. I'm the fundraising manager for the Cornwall Community NHS charity, newly branded. So thank you very much, Daphne, for your newsletters. They are phenomenal. I don't know what to do without them. You save me a lot of time and effort, so I'm very grateful. And yeah, I'm one of the project leads on Healing by Nature at Trevillis in Liscard, or acre site that we're managing there. And I've also sadly got to shoot off just before 1, so sorry. But thank you. I don't usually get to join this slot, so I'm really pleased I'm able to make it today.
Brilliant, lovely. Thank you for coming. Catherine, you're next on my screen.
Hello, hi. So I'm Catherine. I am, like Annette and Martin, I'm a project officer, so primary care resilience project officer, and I cover the north and east of Cornwall. And I think for once in an online meeting, I have met most people in real life, which is quite exciting. So, hello.
Thanks, Catherine. And last but by no means least, Spencer.
Hi everyone, I'm Spencer. I'm the business strategic partner at Proba Surgery and the National ICS Leads Board Chairman for Net Zero.
Brilliant, thank you for joining us. So this is String of Green Pearls. So a quick update from us. So you may or may not know, but our previous colleague, Emily, who was a project officer for the North and East, and Eve, who was doing a brilliant job, were leading on String of Green Pearls, and Annette's been picking it up in the handover, and now Catherine's joined us. I'm hoping that Catherine might want to pick up and lead on String of Green Pearls for the work that we're doing here, based on her experience and knowledge on all things green and wonderful and growing, I should say, in her past experience. But between both of us, I think we've pretty much got it covered, based on my experience working up in Bristol and looking at the green spaces for health. So just on that, I don't know if you've all had a chance to have a look, but the climate resilience team have a new website, and if you've had a look, this is the new website, and one of our green pearls is featuring across the front page, but also on the projects there is a whole page dedicated to green spaces for health. It will develop over time as more and more green pearls come to life, but you can join the Green Pearls network, which obviously you already have because you come along today. But what you might find interesting is that we're collating a whole load of resources around green spaces for health, and so have a look. It's new day, it's early days, so we are still in the process of pulling it all together. So likewise, if you have any really useful resources that you want to share with us, any examples of best practice or case studies or research papers or anything that you feel would be really beneficial that others might be able to use for funding applications or links to local nature recovery strategies or things like that, please ping them over. We're trying to update it as we go, so it's still very much work in progress. For those of you that are interested, there's also information about our Well-Fed programme on there too. So the key thing for me is that I really wanted to introduce you to Daphne. So I'm going to hand over to Daphne. And Daphne, could you give us a brief overview of what you're up to in Natural England and potential funding opportunities coming our way?
Yeah, that's great. Yeah, as I say, I'm the Southwest Health and Environment Hire Officer with Natural England, and I work very closely with Kate Main-Price, who is the Senior Officer, and she's more of a strategic role, whereas my role is more grassroots. We've been having a focus on mid-Cornwall and sort of plugging into the rest of Cornwall where we can for the last couple of years. So we've got a variety of projects going on. As Stephanie said, I do a funding newsletter which comes out every couple of weeks, and I get that from various places, mainly grants online, and it's really focused on the nature-based funding, because funding, as we all know, is a real issue with the Green Social Prescribing agenda, but there's all sorts of opportunities on that newsletter. From things like breakfast clubs, because I always think, well, actually, if children are going to learn about nature and get into nature, then there's no point in them doing that unless they've got a bit of breakfast in their bellies, and it's right through to supporting with dementia. So there's a whole range of funding opportunities there. Natural England sadly have very limited funding that we can come along to, so I think that's probably the best thing that I can offer with regards to funding advice. Talking on funding, we have just had some evidence into delivery funding in Natural England, and Ty Berry, who's involved with nature recovery in Cornwall, particularly on the lizard, we've both been successful in getting some money for that, and that's going to fund an RSPB nature prescription for the lizard, which is very, very exciting. If you've heard of the nature prescriptions, but they're basically a day-to-day task that people can do nature-based. The project will produce a leaflet which will go out to healthcare workers in the lizard area, and then the healthcare workers can work with their clients and patients using that nature prescription. So that's really exciting. So we're pulling together a group of people from the lizard, including hopefully somebody from the community, to actually design that the nature prescription and make it quite specific for the lizard where we can. And our hope is that we will be able to roll it out further across Cornwall to other areas. So it's a really exciting one. It's the first RSPB nature prescription we've had in Cornwall. So probably there's not a lot else that I can say about funding, really. I think the big frustration with funding is a lot of green social prescribing projects get funding, but it's then that continuity of the funding, and quite often funders often want to fund new innovative projects, but actually we need the funding to keep things going. And we've really got to look forward to, where we can with the NHS 10-year plan is to get care into the community and more preventative, and then whether some money will follow that. But I think the green space and green social prescribing has such a key role to play in that. So with regard to other activities we've got going on, we're looking at a project. Kate's leading on a project with Young People Cornwall, which again will be have a lizard focus, so that's really exciting. And we're just looking at various opportunities that we can support within on the lizard. Another sort of one of my main projects I've been involved in the last couple of years is park yoga. I spoke to Julie Pollard soon after I started, and I said, well, what would you like us to bring to Cornwall? What can we help with? And she was saying, well, things like walks, yoga. I just had a conversation with somebody up in Dorset about park yoga, and so we explored that, and we got the 2 sites to start off with, and I think now we're up to 9 sites and hoping to increase that by another possible 2 sites next year. But we had 600, I think it was 6,600 attendances at Park Yoga last year. So that's people getting out into their local parks, which is really what we want to focus on. When we're talking about green space and access, I think people often think, oh, it's getting out in the countryside, but it is as much getting into people's local green spaces and encouraging them to use those spaces that are close to where they live and looking after those spaces. We've been doing various training as well with healthcare workers, so wherever we can, just sort of raising the awareness of the importance of nature action for the health and well-being benefits, but also likewise that the more people are connected with nature, the more they are likely to look after their environment. So it's really sort of to drive that forward, and simple things, you know, that when people are seeing clients and saying, we'll go for a walk, it's taking that extra sort of route and saying, well, actually go for a walk in a green space, go to your local park. So actually really encouraging that nature connection as far as possible. We've also been working in Mid Cornwall. We ran the Walk Festival last May, in association with Eden Project and Cornwall Wildlife Trust. And we're hoping to repeat that again next May, which is really exciting. So that was a series of walks, and we also had a nature discovery event for people who might not normally access the countryside, but actually it worked. It was really quite a success, and we want to build on that this year. And we had a leaflet as well, so that people could take the leaflet and actually follow those walks going forward. So it had that bit of legacy. And also working with the Cornwall National Landscapes, and they've got their new project on Bodmin Moor called Natural Beauty and the Beast. And we have a number of social prescribing link workers and other healthcare staff and people related coming to an event in November, again, to look at what the community needs. So, you know, the co-design is just so important. So we'll be talking about nature connection, but also asking those people what they think the community needs and actually how the project can support what people are wanting. The exciting thing about that one is that they also have a minibus, which is just so important. So they can actually get people out into the countryside. So that's a great project. So yeah, I think it's really just lots of little bits like that. You know, we're just trying to plug into various projects and organisations where we can across Cornwall, and just build those links. We've been working very, very closely with the St Dennis Community Hub, and we had funding last year, so we gave some funding for them to develop their outdoor space, and that's been so successful. They've got sort of groups who actually go and use it, so it's been lovely to see. So yeah, but you know, if anybody's got any thoughts or ideas, then you know, do get in contact, and we'll support where we can. And so we are very limited, and there's just the two of us across the southwest. But where we can, we can have things.
I think you're doing a brilliant job, and
yeah.
Sorry, my connection's not very good. Can you hear me?
Yes.
Yeah, I was just going to say, I think you're doing a brilliant job, and the emails that you send out, the funding emails, are absolutely brilliant. I know me and the team are scouring them on a regular basis when you send them out, and if you're not already receiving them, I'd suggest that you do sign up. So if you contact Daphne, you can sign up to receive them as well. So just in the last week, we've put in an application for some funding, again for green spaces for health, for String of Green Pearls. So we'll keep our fingers crossed on that. But there's always funding opportunities coming through. So if you've got any little bits of land that you want to develop, it's worth having a conversation with us or your local project officer in your area, or me, to see if we can help. And you know, it's in the past we've been really lucky to have some funding from public health to be able to fund these sorts of projects, but there are bits of funding coming through. Has anyone got any questions for Daphne whilst we've got her?
Can I just add as well, in the last newsletter, there was the link to the updated People and Nature survey for 24-25, which again, if you're putting in funding bids, that can give some really useful background figures around the importance of getting people out into nature. But, yeah.
Brilliant, thank you. Stephanie.
Yeah, thank you for that. Something we're looking at doing at the moment, it's actually not part of our, well, we're trying to integrate our sort of under the umbrella term of creative health, arts and nature. We are just about to launch a fundraising appeal for arts, culture and creativity at CFT. But as part of that, one of the very first projects we want to deliver, and we're going to try and raise money for, is a mapping exercise, particularly around the Bodmin Hospital site, because we notice how many people use that site. There's loads of staff there, loads of patients there, loads of dog walkers there. So with one of our art therapists, we're just scoping it out at the moment, how we can get patients involved in that process and do the walks together. But what we're really looking for, and I heard you had a leaflet, and I know Badrigi, is that the right pronunciation? Stephanie might be able to help, have a really beautiful map as well. That's the sort of thing we're looking to produce. So if anybody has any recommendations of any artists, illustrators, graphic designers who'd be willing to work on us, and any advice around costings, because at the moment we have no idea how much something like that would cost, and we'd like a really big board or a couple of really big boards up on the Bodmin Hospital site with the beautiful, you know, quite arty and illustrative map that we produce. So yeah, anyone who can give any advice on that or send me anything through, I'll be so grateful.
I think probably oh, sorry.
No, you go first, Daphne.
Yeah, I was just going to say probably a good person to speak to is Martin, because he was involved in doing a map for active travel between St Denis and Roach last year, and they produced a great graphic, and it was very much involved with the local community, had an input as well. So have a word with Martin, because he'll have the link to the designer, and I think the designer's done other pieces, and I think they got funding through the active travel, so it might be worth asking Public Health if they've got any funding for that, as well as the newsletter.
So that's part of that's part of the work that Martin and my team's doing, and it's one of 11 beautiful day out maps that we've got, so we can put you in touch with the artist, and also there's potential there, so we're looking at some active travel funding that might be able to pick that bit of work up. In addition to that, when I was working with North Bristol NHS Trust, we produced our own little map that's also interactive, and I can send you the link for that. And we're looking, I know RCHT are doing something very similar for Trelisk and their sites too, so I think it would be worth us all getting together to have those conversations, to share resources and link them all in together. Definitely, I'll ping you the information, Stephanie. Stephanie from Badrigi, sorry, go on.
Hi, we had an artist called Keith Sparrow that did our beautiful day out map.
That's him.
So I put the email in the chat.
Yes,
Would
please,
that help?
that'd be fabulous.
Okay.
Thank you. Grateful, really grateful.
Go for it, Daphne.
Sorry, I was just going to say, when you do the mapping, will it include spaces actually in the hospital as well? Because I think it's great to have some mapping. I think often people they're in the wards and actually don't know where they can go outside to get some green space. I think, you know, if it could include that, it would be brilliant. And if you need any walk leader training, Rob Harrison is the chap to ask in Active Cornwall. Yeah,
perfect. Thank you.
That sounds really exciting, Stephanie. I know that they're trying to set up, I don't know if you're on the organisation, but they're trying to set up a walk around the Bodmin site with Adrian Flynn, and myself and Tamsin Anderson. And so we're already looking at that, and we're also looking at a walk around for the Campbell and Redruth site too, linking in with Alan Bean, your sustainability lead for CFT. So it's all connected, and I think the right people are having the right conversations, which is really nice to see. So that's fantastic news, and I will ping you the information about North Bristol NHS Trust and what they've done there. And I've got a PDF version of their map that they've got too. I think when you go into the hospital, they've got it on a massive pop-up banner, and there's a QR code for you to download the map and then use that. But they also have little handouts, probably about that big. I normally have one with me, but they're at home, that people can pick up and take away with them. And actually, that's what I'd like to replicate for the beautiful day out maps too. So I know Martin has just printed off a huge version of one that's going to go up at, I don't want to get it wrong, it's either Arbenek or Roach. I'm not sure. but then to be able to have those little maps that they can either click on the QR code to have them on their phone, or take away a little hard copy that says access to green spaces and walking and cycling to get to that health centre. If we could do something around CFT and have them on every site, that would be absolutely amazing.
Amazing. Thank you.
Daphne, your hand's up again.
Sorry, yeah, I was just going to say as well, for inpatients, if people can't get out, the Forestry England have some lovely resources for helping people to connect with nature.
Wonderful.
It was developed by one of the managers who was actually an inpatient herself and was literally going up the wall with lack of green space. So it's got a real, yeah, it's a really useful tool.
That sounds really good.
you.
Is that something that primary care could adopt across
Absolutely.
the county as well? So is that something that is it a physical resource, or is it online, or
It's online? Yeah. I'll send you the link to it, Tanya, and you can have a look.
That would be fantastic. Or pop it in the chat, which would be even better. Stephanie, is it worth Stephanie from CFT? Is it worth just chatting about Trevillis House to those to provide an update for those on the call that don't know about it?
Yes, of course. Yeah. So what we're doing there, we got funding from the Greener Communities Fund, which is from Hubbub, Starbucks and NHS Charities together about 18 months ago, to develop a 4-acre site that was otherwise completely underutilised and undeveloped, and just a clean slate really for us to adopt and develop, which has been an amazing opportunity, because we do own the land, which is very, very rare for the trust. I think we only own about 16% of our estate. So that was a site that really had potential. So we've had pre-planning approval and guidance from Cornwall Council around what surveys we need to go any further. Really, we're trying to do everything very by the book. So over and above what we need to do really to get this site moving, it is taking longer than we all hoped, but so that if we do it all properly this time, it's something we can really replicate and do elsewhere. And we very much would like to do something on the similar on the CRCH site in Redruth, Campbell and Redruth. So yes, we'll be installing yurts there, compostable toilets, a Neolithic roundhouse, having cold and hot water therapy area. We have got funding from Rob from Live Longer Better fund for a green gym on the site. So we're just getting that installed to really, add that parity to mental health and physical health, because this very much at the moment, Healing by Nature has been a service we're developing for our community mental health team to use with their patients and caseloads. So they are based at Trevillis site, so I guess that's why that was the primary focus. But now that's really expanded out, and so many other teams are looking at ways to use the site. There's already things going on. Occupational therapists are using it, doing like photography walks and things like that. I think what's really happened and developed since probably the last time we met is that it's become much wider, and I'm really pleased about that. Peter Temple has been an absolutely incredible and fundamental force for this project. It really was resting all on her shoulders, which is just too much for any one person. And so now we've got like a working group, we've got a co-production committee who are meeting I think every other week, who, occupational therapists, complex care and dementia teams, the other people who work on the site, and getting the likes of Adrian Flynn in that as well. I mean, he was very much our executive sponsor for the project from the start. But yeah, just bringing other people in, head of governance, head of health and safety, fire safety, food, hygiene, all of these sort of departments that we need to make it a real success, procurement, finance, communications. So that's been amazing. So I think what we've been doing internally, so the site doesn't look that different as to what it did probably 6 months ago or even 12 months ago. We started running Friday campfire catch-ups there last December, and we've sort of adopted an allotment area now that Cornwall Council were previously using. So we've got a polytunnel that we're running sessions out of, getting together, small groups, cooking together, building things together. And we're hoping by the spring we'll have the planning permission that we're seeking and the yurts installed, so that we've got more shelter through the year. So yeah, it's really exciting. We're kind of, it feels like I've been working on this for a long time, but it feels like we're kind of turning a corner now, and actually you know, it's actually coming together, which is really exciting. And there was an open garden event there at the end of September. I think about 60 people attended, I heard, which was amazing. I couldn't make it, sadly, but hopefully next year when we do something similar, maybe bigger, we're looking at like maybe a nature and potentially arts, creative health sort of conference that Adrian would be leading on. Then obviously you'll all be invited, and we'd love as much contribution to that as possible. But yeah, it's really expanded out. We've got physical health nurses attending the group on a Friday. We've got Healthy Cornwall coming doing smoking cessation. You know, it's fantastic. It's exactly what we wanted. Really collaborative, lots of community input. Yeah.
It's absolutely brilliant. Fantastic. And we were there at the launch, and I know that our project officer for Well Fed was there, and she's already eyeing up the walled garden and the kitchen facilities in the lodge at the back to see if we could use it to deliver some of our Well Fed programmes. So that's addressing type 2 diabetes through veg boxes on prescription and being active in nature. Thanks ever so much, Daphne, for coming along. We really appreciate it. Come back next time.
Yeah, will do. Yeah, and I've just put those forestry resources in the chat. So
yeah,
brilliant.
Thanks.
Thank you so much. Cheerio.
Bye.
Stephanie, it's brilliant. It's brilliant that you're able to join us and provide an update on CFT. And I'm going to try and get someone along from RCHT to come and provide an update too, because they've got a lot of stuff happening up there as well. So we've got a little bit of funding, and we're going to be working with them to deliver a staff and patient garden. No, sorry, a staff wellbeing garden, particularly for the staff on site. So watch this space, and I'll be able to report back to you later when we know more. Just on that, the Climate Resilience Programme have sent out a survey to all of primary care recently. So Stephanie Jones, you should have received one, and if you haven't, please check your inbox. So it's just collating information about everything that practices are doing across Cornwall and the Isles of Scilly, but there are some questions in there around green spaces, so looking at what green spaces you have and if there's anything more that you'd like to do. But by the sounds of it, you're already very active in that area. We do have one site that I just wanted to share with you that came up recently from a site visit with staff. So this is the VOR site. So some of you might recognise it, but it's such an amazing opportunity. There's these raised beds to the rear of the building that are empty and a little bit unloved, but we're putting our heads together to think, what can we do? How can we raise some funding to fill these with soil and get some edible perennial herbs in there, or other vegetables growing that staff and patients and the community can come and use on a regular basis. So this is propped up recently. So Stephanie Jones and Bodrigi, if you've got any ideas or ideas of funding or how your garden and your veg patch is working, we'd be really keen to hear. And or anyone else, if anyone else has got any other ideas. Stephanie, that's fine. You crack on. Lovely for you to see you and come back next time. Or Spencer, if you've got any ideas. This is the sort of thing that we're trying to do across the county and replicate. Obviously, we're applying for funding as well to enable and facilitate practices like this to get theirs up and running and off the ground. But it's such an amazing opportunity, and they've got a little bit of green space as well towards the back of the site too. So yeah, any ideas or suggestions or top tips based on the work that you've done on your sites, we'd be really grateful to hear. You've got to go too. She's got to go too. And then there were three. So yeah, so Spencer, I know you've got.
If there are any funding opportunities, particularly with our the sensory garden idea that I had here, because we've got the perfect space for it. I just haven't had the headspace recently to be able to do it. It's just been a bit nuts to me, but it's something I need to do. To me, so I'd be keen to explore that if that was possible.
Okay. we'll watch this space then. We'll keep you posted as and when we get some
Awesome.
funding, and we'll see how we get on. And I think between Catherine and I, we can pick this up. Catherine's attending the Local Nature Partnership Conference tomorrow with the Nature Recovery team from Cornwall Council and the Local Wildlife Trust. So we're hoping to align the work that we're doing with primary care to the local nature recovery strategy, to make sure that the projects that we're working on align with what they want us to do in those spaces across the county. So that would be good. I think that's probably it from me, unless Catherine or Spencer, you had anything else you wanted to share or chip in, or suggestions or feedback on anything related to green spaces for health.
I think from my point of view, so I obviously attended the National NHS Primary Care Conference in Birmingham last week, was it, or the week before?
Yeah.
No, it was last week, I think. I can't remember anymore. Alarmingly, there was hardly anything to do with net zero or green initiatives or anything. Honestly, and I attended the one session that was there, that was extremely poorly attended anyway. And I met two people who I'd never met in my life before doing it. Do you mean? And what they said, you know, I don't want to take anything away from anybody. They're obviously keen and stuff, but they've obviously been paid as well to go and present that day. But they didn't have a clue what they were talking about. And they were talking about things that were 4 years behind all the good stuff that we're all trying to do. It was, yeah, it was disheartening. Let's put it that way, I think.
Yeah.
To me, I think, you know, and it really bothers me that obviously there's no mention of it at all in the 10-year plan. I mean, I say 10-year plan, it's not a plan, is it? It's a document with no planning in it. But
It's a strategy, isn't it?
why isn't that in there? I just don't understand. I mean, and we were thinking it's a 10-year plan. This is taking us to 2035-ish.
Yeah.
Do you mean, why isn't it higher on the agenda with all of this? Do you mean? And yeah, it was quite. Yeah,
It's definitely a missed opportunity, isn't it, in terms of prevention and health creation and promoting mental health and physical health and getting outside. I think I hear you. I do have a little bit of good news in amongst the chaos. So last week, the joint clustered Devon ICB and Cornwall and Isles of Scilly ICB approved unanimously the Southwest Peninsula Green Plan, which is the joint plan. So this is it. It is online currently. It talks about the two ICBs and the progress that they're making, and what they've been doing over the last 5 years and their intentions for the next 5 years. It talks about net zero and the national strategic context and the local context, particularly here in Devon and Cornwall. But more importantly, let me just scroll down to it. It does mention supporting primary care, which is good. And it talks about the vision. So the vision is to reduce the environmental impact. So this is the net zero work, adapting to a changing climate and creating healthier communities. And green spaces fit firmly within there. But more importantly, the areas of focus. So the green plan areas of focus, so primary care is within there in terms of working with primary care providers to reduce carbon emissions and pollution and develop healthier communities. But under estates and facilities, it does talk about providing a more therapeutic environment for staff and patients. And I think we've really got to take heart from that, because it does talk about that, and it does reference it, and throughout the document, so it focuses on the areas, on those key areas, but within the document itself. So let me just scroll down. So medicines and primary care. Separate to primary care, though, there is a section under estates and facilities. Where is it? So there's travel and transport, estates and facilities. So it does talk about, where is it? assets, biodiversity. There's a whole section in there around biodiversity and nature recovery. So please don't be disheartened locally. It does. There is still a place for green spaces for health. We all know that there's still a place for green spaces for health. Just because they didn't cover it at the national conference is a shame, but it is in there and it does exist. And I think the commitment that the fact that this document was unanimously approved by the clustered ICB shows the direction of travel.
And it's good that we're not losing momentum in Tanya, because we have been really ahead of the game in Cornwall, and and you guys continue to be really proactive. So this is fabulous. Well done, brilliant.
Good. That's really good to hear. And also just under the actions for the next 5 years, under the Southwest one, it talks about the in line with UK government commitment to conserve a minimum of 30% of land and sea for biodiversity by 2030. So it talks about the 30 by 30. So looking at baseline surveys around biodiversity and net gain opportunities, identifying suitable sites for tree planting, increasing the number of trees and shrubs, and using nature-based solutions for flooding, heating and shade. So it is in there, which is really good, and it does focus on primary care in Cornwall and the Isles of Scilly, particularly around the work we've been doing. So that was energy. 35% of practices have been improving natural spaces at their surgery sites, creating gardens and green spaces supported by Volunteer Cornwall and in collaboration with wider local organisations for the benefits of patient and staff. And it also focuses up here on CFT and talks about their green spaces for health, the work that Stephanie was just talking about, and the Healing by Nature project, and under RCHT as well, it talks about what they're doing in relation to their site. And I know for a fact that they're investing quite heavily now in terms of the capital design around the site and making sure that green spaces for health are included in there. So it is positive. It is positive.
Good. Really positive.
So take heart. So it is in there, and we just need to make sure that it continues. So that's what we're going to continue doing.
Fab.
Brilliant. Catherine, anything from you? No.
No. Sorry, I was
No.
I was busy trying to find my mic. Yeah, I was just trying to find all the bits and pieces. No, nothing more from me. Yeah, just looking forward to making more pearls, I think. Good.
Brilliant, perfect. Yeah. Right, I'm going to stop the recording. There we go.